opportunity for our students to be able to have some direct conversation with our school leaders about where we are in terms of school openings. They had a chance to, the students had a chance to talk together to prioritize what was most important, and the questions that were coming up had to do with questions to public health about what's important related to, is school safe, what does the data say, you know, those kinds of things. And so we're expecting Dr. Santora to join us. And when she does, we'll pause for a second, get a report from her, allow the students to ask her some questions, and we'll keep moving forward. But at this point, I'm gonna hand this over to Ella and to Talia. They've been serving sort of as the leaders of the overall student group. And they've been, if you recall, the last time we were together, there was conversation about what they could do to provide some additional support to students. And so they put together sort of an incredible set of trainings for the students in our community. This is being translated in Spanish and will be recorded and available in 24 hours. Araceli, I probably did way too much. Can you just give a little bit of what I said for any Spanish speakers that may view this later?
Primeramente, bienvenidos a todos. Estamos muy entusiasmados de tener a todos los estudiantes aquí presentes, y nuestra superintendente Mary Jane Burke les da la bienvenida y aprecia mucho su participación en esta pequeña conversación. Así que el motivo principal es realmente informar a nuestros estudiantes de cómo estamos en relación al regreso al salón de clases. Entonces vamos a estar hablando acerca de cuáles son las regulaciones. Vamos a tener la presencia o la participación de la doctora Santora, que es la oficial administrativo de salud pública. Así que les pedimos que cualquier pregunta, cualquier duda, esta es la oportunidad para que ustedes sean parte de esta información y puedan colaborar con nosotros de alguna manera hacer este regreso a clases exitoso para todos.
Great. Thank you so much, Araceli. Okay, who wants to take the lead? Ella, let's pass it to you.
Yeah, okay, thank you so much for that introduction. Thank you to everyone who is here. So on our last Zoom meeting, we were thinking about different ways to help students with their mental health during this time, especially because of the continuation of online school because of COVID cases. So with the help of Michelle Drake, a group of students, including myself, Talia, Elsa, and Alyssa are also on here, we brainstormed some ways to help students out with a student speaker series. So Michelle, could you share the brochure on the screen? So we have a couple different categories of speakers that we really want to get involved. The first is Michael Pritchard, working with Community Through Unity. So there's a couple dates on here that he will be speaking to students through Zooms. Another category we're focusing on is the SPAR Center, which is hoping to connect with LGBTQ+ students to discuss school culture and strategies to address homophobia and transphobia. We'll also have a digital wellness, which we're going to have a speaker come in who's really great and focusing on students and their social media images. Another one is More Than Sad, which is the American Foundation for Suicide Prevention. So we have a couple dates for those speakers. Next, we have Mindfulness Through Movement, which is a really great way for students to become engaged through mindfulness activities on Zoom. And our last one is Substance Use, which is which is led by the Youth Opioid Team in Marin, and it's discussing harm reduction principles and the tools to minimize the dangerous effects of substance use and treatment options. So Talia, do you want to explain how people will be accessing all of these meetings?
Yeah, so I'm going to put 3 links in the chat. The first one is just the link to this same flyer. so you can really get this information, see, you know, which ones you might be interested in, share this with friends. You don't have to come to all of them. We would love for as many people to participate as possible, but we want you to share this with the people who you think might benefit from one or two of them, and really target kids who might want to learn about pride or mindfulness. So it's really important that we have you guys share this out as much as possible. And you can also find this information through the second link, which is on our website, the MCOE website. And then our last thing that we really want you guys to get involved with is we have a Google form, which is the last one, where you can put your email address to stay more informed about the speaker series, and also to get involved in the leadership with Ella, Elsa, Alyssa, and I, so that we can have more input from students in the county to really further this speaker series and other mental health initiatives through our county. And if you want to fill this out now or at the end of the meeting, we're going to put these links back in the chat again, but we want you to fill it out if you're interested. You can see it up here on the screen. But really, please let us know if we can, you know, get you involved in this. And we want as many students to be invested as possible. It's also important to note that our registration isn't currently open, but we're working on that in the next week. And if you're on this email chain, we can send that out to you. There'll also be other ways that we're going to communicate how you can register, how you can help others register. So please look out for that.
And we'd love to get some more boys involved, because right now it's mostly just girls involved in the leadership. So any superintendents in certain districts or anyone who's on this call, if you have any students in mind that you think would help out with this, we'd love any recommendations for that. And also just for the superintendents and district leaders on this call, we would love for you guys to send this out throughout your districts. There's some really, really great speakers that we have on here, and we think it's a really great way to keep the community together and keep students hopeful, and just be a way for students to have a little bit of a break from all the stress of online school. So the more that you guys can share this out and spread it around, the better. So we really appreciate that.
Great. Okay. Jim, do you have any questions? Are you impressed?
Yeah, I think that's a great, I want to go to those. It's totally, I appreciate the topics and I appreciate the links. So Talia and Ella and everybody else, thanks so much for putting that together. I think it's much needed. So thank you.
Great. Okay. Anybody else have any questions for Ella or Talia or other members of the team? Okay, then let's go ahead. Dr. Santora is not here yet, right? Okay, so let's go ahead. I'm going to call her in 1 second. So let's go ahead and move on to questions for the school leaders. So Ella, I'll pass that back to you.
Great, thank you. Okay, so our first question, this one's brought up a lot, but what will it take for each district to go back? Is there a certain tier? Are there certain state laws? I know that this was addressed in a Zoom earlier in this week, but if some of the district leaders could just report on what it's going to take to return back to school, that would be great.
Well, I'm happy to speak for Shoreline. What we're looking for at the for our middle schoolers and our high schoolers is that we need to be in the red for 2 weeks. And what we were hearing earlier today is it appears that we might be talking about February 15th or so as a target, given the arc of the data that's going along. So in the meantime, at all of our, I know at Shoreline, we're putting together learning hubs for the students that have difficulty connecting to the distance learning at, for a lot of, in our instances, it's geography, but trying to create opportunities for them to be able to come in to school, have access to robust Wi-Fi, as well as the other services that we can provide.
Great. Okay, so Dr. Santora is here now. So, so Lisa, are you here?
I think she has to become co-host to.
Yeah, can we move her to co-host?
I can talk now. Hi.
Okay, great. So Lisa, this is some leadership students, as I mentioned, and as they were talking about what would be helpful for them, they wanted to have an understanding of sort of that overall, is it safe to go back to school? Is it safe? And perhaps within that context, it would be great for them to hear from you. We are taping this, so it'll be available to others, and it's being translated in Spanish in real time as well. So thank you, Dr. Santora.
Thank you, everyone. How are you? Great, great. Happy New Year. So I'll give you a really quick update with where we are so you can kind of see the landscape of our COVID-19 response. And I recognize many of your faces and names. So thank you for continuing your leadership and supporting us. Everything we do is focused on students and getting you back safely into school and supporting your academic as well as your emotional and social development, which we know has been really hard. I have a 10-year-old son, a little bit younger than you guys, and he's done with Zoom. And I'm sure many of you are done with Zoom too, although he still seems to want to play some video games, but Zoom he's done with. So we have been focused since the beginning on getting you guys safely back into school. Where we are now as a county is that we are still under a stay-at-home order. And I get to hear all of the stories of people who haven't stayed at home. Staying at home is really the best tool for us to decrease the number of cases of COVID-19 cases in our community and to decrease transmission. Honestly, what we saw over the really started since Halloween, and I'm sure you hear the same stories I've heard, and it's gone through Thanksgiving and into the holidays, is that people really have been gathering indoors together with family members, non-family members, household members, non-household members, and that's really what's driving up this highest rate of COVID-19 cases that we've seen in the community. And that is, it freaks a lot of people out, rightfully so, that we have such high COVID-19 cases, because what we're concerned in public health about is, number one, of course, we don't want people to die or get sick from COVID-19. In teenagers, most teenagers who contract COVID-19, you might lose your taste, or you might feel bad for a day or two, and you get over it within a day or two, and it might feel like nothing. But we see that 5% of all active cases with COVID-19 in Marin County, and we're a healthier county than many, so we have a lot of protective factors to prevent hospitalization, but 5% of people with active COVID-19 are hospitalized. And then we have seen, I saw a new number, and we're reconciling our data, but upwards of 150 people have died in Marin County from COVID-19, which is why these stay-at-home orders are so important, because you just don't know. And I know the temptation is great to see other households, but you don't know where the brother or the aunt or the uncle of that household member, how safe they have been. And that's the challenge. There's nothing to tell us how safe someone has been, and you don't know until you test positive for COVID-19. And so that's where we are with the order. I'm still seeing I get an update every day. We're seeing around 100 cases a day. We know a lot of people traveled to Tahoe, met with other family members that weren't part of their household. We know public health hears, and even hear names of people, which I don't need to know, but we're anticipating that this might be our highest rate of cases this week. And then we're hoping, honestly, once school goes back in session, and we see schools really as a stabilizing factor, when schools go back in session and people are back at work, they'll stop socializing and gathering and get back to the protective behaviors that we've seen. If you remember, we were at orange one time for a couple of weeks, and we were red for a long time. We're the last red county in the Bay Area. So we know Marin County residents know how to be safe and implement their protective behaviors. And so our hope is to get there and to get to the red zone, which is good in football. And it's also good for reopening secondary schools, which includes our high schools and middle schools. There's only the high schools and middle schools that were open before we hit tier 1 or the purple tier can stay open. So we do have some private high schools that are open right now, and they've been open since the beginning. But at this point, as long as we're in tier 1, the state does not allow a secondary school that hasn't been open yet to open. So that's what we're really waiting on together. And again, I try when I get a lot of emails and try to communicate to everyone who looks for exceptions to the rule. Everyone thinks they're exceptional, but why it's so important for us all to hunker down, because that's what's going to allow us to get back into the red zone and to allow the amazing school leadership that's on this call to achieve their goal of getting your middle and high schools open. And we can do that safely. What I'm so proud of, we have over 500,000 student days now. That's the number of days students are at school. And you only get credit for the days you're actually in person. So it's not an inflated number. And we've only had 6 documented cases of suspected school-based transmission. And that's really, really low. We've recalculated our data. You're 10 times more likely to get COVID-19 at home than you are at school. Because when you're on the school campus, you're following the rules. People are watching you follow those rules. They're using a bullhorn to tell you to stay 6 feet away. You're wearing your face coverings. And we really see this, especially for teenagers, that this is such an important, school is an important place for socialization. And when you don't have the opportunities to socialize in a supervised environment, we know it's just natural to want to see your friends and to gather outside or in someone's house where you're not wearing a face mask and where you're not staying 6 feet apart and where you're eating together in the same room. And that's what allows their spread to happen. The good news too is that I think it's around 30% of all the student days are secondary school days. So it's middle schools and high schools that are back on campus in Marin County. Each school is done a little bit differently based on their culture and how ready they are to grow in size. But of all the school-based transmissions that we've had, none have been at the secondary school level. And that's not surprising to me because if you can imagine, I have younger kids. It's harder to keep younger kids away from each other and to stop and being close with each other. And a lot of elementary school principals and teachers will tell you that. It's like constantly telling them to be 6 feet apart. And you guys know, we know you know what gets you sick. We know you know how to take care of yourself. And we know you have a good estimate of what 6 feet looks like when you're on the school campus. And we have seen that because teens want to get back into school, they really are doing a great job at following the rules on campus. And so that was me blabbing for a while. So happy to answer any questions that I might have. Oh, vaccine. So we're working really hard to get vaccine out right now. We're going through what we call phase 1A. That's your healthcare workers, the people that work in nursing homes. And our goal is to get to phase 1B, which will include school staff and teachers. And we hope that once they get vaccinated, and this is an interesting space for me as a doctor, they're not the highest risk group at all. Because the schools really are safer environments for people to be. But we know that for many school staff to feel safe going back onto campus where it is a congregate setting, they want to get vaccinated. And so Dr. Willis led earlier than the state saying that we would prioritize school staff getting vaccinated. It was followed by fortunately the governor agreed and the state agreed because we see the harm of not having schools in session is tremendous. And we want to make sure we do everything we can to get schools back to normal operations. And we're going to be under new normal operations for a while, but get back to the new normal operations as quickly and safely as possible. And then the other thing I hear a lot is the variant, the UK variant. What does that mean? Smile. I listen.
I'm sorry.
I followed instructions. I stopped and took a slow breath and I smiled. Hard to do when you're from Jersey to stop talking quickly. But onto the UK variant. That variant has probably been in our community since September. They identified this variant in September. There's lots of travel between the UK and the Bay Area. And if they identified it in September, it was probably circulating a while before then. We send a portion of our samples when we test, we do go for genetic sequencing, and we haven't seen a shift in the makeup of the variants that are circulating in Marin County yet in a way that happened in southern and South London or the southern part of the United Kingdom. That being said, the same things that protect us from this variant is the same thing that protects us from all variants. There's 6 different strains, there's many different mutations, and washing your hands, wearing your face covering, trying to stay 6 feet away. That's the best thing we can do for protecting the spread of any variant of this bug.
Great. So students, anybody have a question while Dr. Santor is on the phone? Yes, Zach. We need to
Okay.
unmute Zach.
Oh, thank you. I was wondering if there's a plan as to how often teachers and students are going to be tested, or if that's a
Good question. We're learning from the state what that plan is. The population we like to test are people that are symptomatic and have been exposed to COVID-19. That's when those tests work best. When we test people who don't have symptoms and don't have a known exposure, we have a risk for both false negatives and false positive results. And it goes high. And so that's one of the risks. That being said, UCSF did a study on the Binax Now. It's the antigen, the credit card type of test, and has shown that it does a really good job of identifying who's positive. And so we did a pilot of this test with San Rafael School District. It's getting tested regularly is not fun. Once you get tested once or twice, it's not the most fun thing to do, and it adds another extra step of getting into school. But we're waiting to hear from the state around guidance for what they're going to recommend testing. What we're expecting, and it might change, it's not official until I see it in print, but we're expecting that they would recommend testing when communities have schools in session in what they're calling deep purple. So we have tier 1, which is our purple tier. That's if you have more than 7 cases per 100,000 residents. That's an adjusted case. And deep purple is more than 14 cases. This week we're at 15.2. And so it's possible. The recommendation we're expecting them to say is you would recommend once a week PCR or molecular testing, or twice a week antigen testing if we are in deep purple and schools are operating. That being said, this would be new for schools to do so frequently. Again, there's school staff want to be reassured that there's trying to create the lower possibility that COVID will be on campus. I support that. Again, I think we'll see how this rolls out, because I think California would be the first state to roll out testing at such a magnitude at these levels. And again, what we go back to is when we developed those plans in the beginning, we had a universal precautions approach, and I think anytime I walk in a room with someone, I think they might have COVID, and that's how you should go through your day. And so and you might think you know what someone did the day before or 5 days ago, but you don't. And so making sure that you just practice those best behaviors. And again, I think Marin County has been leading and showing that our students and staff can create a safer environment. And there's never a no risk. I mean, in past years, my hope is that we'll get back to what it looks like in a normal flu season. So, and then the question I saw pop up is when schools are going back in session, and that's up to each district. So they can't start, if your school hasn't been open, they can't open until we go into red, unless the state changes it, which we thought the state would have already changed, but they didn't. But once that changes, we would talk to the schools, but it takes a lot to get the school machine ready to go. So I think a lot of the schools are looking in that, the secondary schools are looking in the February timeframe, but they'd be better to comment on that than me.
Any other students with questions? Sophia, do you have a question?
I don't know if you guys know this, but once we go back to campus, do you guys know what the schedule would look like for high school students, how often we would actually be on campus for in-person learning?
Okay, Sophia, we're going to take that question and let each of the districts give you an update. So we'll come right back to that one. Anything else for Dr. Santora? Okay, seeing none. Dr. Santora, thank you very much. One of the things we're going to forward to you, though, is the students just shared a whole series of trainings from a mental health standpoint that are going to be available for students countywide, 3:30 to 4:30 on multiple days over this semester. You'll be very impressed, and we'll get it to you to see if you could also post it on the website of the county, because it's going to be a great series for young people. So that would be fabulous.
And I just want to thank all of you. You're demonstrating great leadership and resilience during probably the hardest time in my life. And I've lived longer than you. And so I'm sure it's one of the hardest times already in your young lives. And I know you are our next greatest generation. You've learned so much. I tell my kids when they're having a hard time, they are going to be so much stronger and more resilient and make our world a much better place. I know the world looks really chaotic right now. I saw a clip of the news today, but I know that it's going to be a much brighter year. And a lot of that has to do with all that you guys have been doing and how strong you've been. So thank you so much.
All right, thank you.
Thank you.
Okay, Ella, back to you. And then I don't know if you want to, per Sophia's question, to have all the districts do a quick update of what their plans are.
Yeah, that's great. That'd be great for the districts. And then I think Talia has a question after that as well.
Actually, my question is a little aligned to the schedule one. I think that some districts have a ballpark idea or even a more exact idea of the numbers of students that they might have coming back. If you could just include that in your answer. And I know that it's site-based a lot of times, but just to give an idea for our high schools and our middle schools would be awesome.
Who wants to start?
I'll
Tara,
go ahead
how
and
about
start. I'll go ahead and start since we're the smallest high school. Smallest high is the smallest high school. We normally have pretty low class sizes to begin with, and so our goal is to when we do, we're going to go through a period of time of opening up some learning hubs on campus with the support of the county office. They've been really really helpful in helping us organize those and get in. You know, follow these rules. Don't worry about those rules. These are the rules that you're going to be held to. That kind of helping us navigate. Our goal then is to be able, if we want to be ready to start bringing back our students into discrete cohorts on campus by the end of this month, and that'll, whether that actually happens or not, it's going to have everything to do with the numbers in the county, with the openness the state might have about waivers for secondary or high school, all sorts of things like that. But in our case, because we already have low class sizes, we're going to be able to bring, when we come back, we're going to have all students on campus every day.
In Novato, we're looking at when the time is right to be able to bring our 7th, 8th, and then high school students back onto campus. We'll have about half of our kids on campus at a given time. Kids will be broken up into 2 groups. Group 1 would be on campus Mondays and Tuesdays. Group 2 would be on campus Thursdays and Fridays, and Wednesday would be all remote. It gives us time to clean desks in between different kids being at those desks, and just gives everybody a chance to get in front of their teachers and teachers to get in front of their kids. So we're really looking forward to that day.
Yeah, in Santa Fe, there's we have a bunch of different things happening. The process is we have reentry committees at both middle school and high school. We have safety committees, making sure that all the school site specific safety plans and protocols are being worked out. And then we're also we're coordinating with our teachers unions because we need a memorandum of understanding. So it's actually a little more complicated than it might seem at first. So we're making progress on all those fronts. In middle school at Davidson, it really looks like there's going to be a 3-phase process. The first one is bring back students in period 1. The second phase would be kind of a 2-day-a-week thing like Chris was talking about. And then the third stage would be kind of an everyday minimum day schedule where students would come for all 3 periods because they have a 3-by-3 schedule and be done by about 12:30. High school, we're still working on exactly what it's going to look like. We also did a survey of our secondary students. It looks like about 60% want to come back and 40% are opting for online. And so we're hoping to be able to stream at the secondary level, stream students into the class every day. So our high schools have a 4-by-4 schedule, and it's going to be hard to cover all that material if we're not able to meet every day. So we're hoping to be able to use technology so that whether students are in person or they're being streamed in, they'd be able to hopefully hit those classes every day. So that's kind of the long term, but we have a way to go. And as Chris said, I think we're looking for, we've talked about February 22nd, maybe March 1st, right around there. But as Bob Rain said, is we have to be out of the purple and into the red for at least 2 weeks before we can even start. So that's a little bit about where we are in Santa Fe.
Yeah, so like everyone else, for us, you know, it's getting back into the red, and then those numbers are super important. So we're watching those closely. Really appreciative of our partners at MCOE and Public Health for guiding us through this. We're ready to open when we can. We've been working really hard, for a long time. And like Jim, Mr. Hogaboom, we are going to keep the schedule that we are working on right now. So Mondays will be fully remote for all students. Our students are going to be broken into 3 cohorts. We're actually at our peak enrollment this year, and we just couldn't fit kids on campus 6 feet apart in most of our classrooms in just 2 cohorts. So we will have 3 cohorts, and the way it's going to work for us is all students will be on campus at least 1 day a week. And each cohort will rotate being on campus 2 days a week. So that'll be like a 3-week rotation for us. The schedule is going to remain the same. Mondays are fully remote. And then we do the double block A and B block days on, Tuesday, Thursday, Wednesday, Friday. And it's a full schedule. Or when they're on campus, they'll be on campus, 8:30 to 2:40.
Okay, any more questions? Ella, Talia, Elsa?
Yeah, we just had one last question about sports and what that's going to look like for different schools. So the districts want to answer what the plans are for sports. That would be great.
I can start. The sports are being guided at the state level. So it's the state that has released guidelines around youth sports and competition. And they had postponed competition, but we're still allowing the workout and conditioning. So what is being allowed right now is that teams are allowed to work out outside. Everyone's supposed to be wearing a mask even while working out. And it's supposed to be strength training and conditioning only, no actual play. And I don't know if someone else wants to give, I know they're revisiting the return to competition date this week.
Yeah, I mean, this is a decision that's really out of our hands, like a lot of decisions these days. This is going to be up to the CIF and to the North Coast section to determine what return to sports looks like. We've allowed our students in Novato, and I know all the other schools in Marin County have done the same, to do as much as we can under the rules with the conditioning, knowing that, how important athletics are to kids from a competition standpoint, but also from a social emotional standpoint, and just feeling good about things and being together with your peers. So we will continue to follow the guidance that comes down from CIF. I think that there's a chance that some sports seasons still happen this year, and that others don't, just because of the nature of the sports themselves in a time of a pandemic. But we'll see how it goes, and we'll follow the guidance.
Great.
Ellen, what did you post?
Michelle just sent me a link that has updates about sports updates. So I just put that in the chat for anyone who wants to access that. Yeah, so does anyone else have any questions? Oh yes, one question.
You need to unmute Mr. Fisk.
Yep. Hi, thank you. Our site had one question on vaccines for educators, because Dr. Willis was on TV like in December. And at that point, he mentioned maybe the end of February. So we had that question.
Maybe I'll take that. What we heard, so just today, the superintendents had a meeting and the information was reviewed. What we think we know is that Marin County, unlike what you're hearing across the state, is ready to go, meaning they have their distribution plan ready. Our issue currently is our supply. So that's the question. Educators, and I want to make that definition for you, educators, it will include anybody working at the school site in our school. So The custodian, the classified staff, the school secretary, the teachers, etc. Also includes people that have been working in these learning hubs along with childcare workers. So we've got a big group. For just the public, private, independent, parochial TK-12 system, that's about 8,000 people, just to give you a sense of scope. And so what we heard today is that currently they've leveled this. We're in level 1A, and that's first responders as well as frontline doctors and nurses. And they think that that those should be finished in Marin County within approximately the next 10 days. We have been prioritized, not me, but educators, particularly those working with kids, have been prioritized by public health in Marin, and they were actually ahead of the state in the prioritization. So the issue is going to be, what will the supply be, right? So will there be enough of a supply? And so the superintendents have a subcommittee that will be working on prioritization within that structure, meaning the priority. So just as an example, that a priority would go to someone working in education who's in a school or going to schools. They would get priority, those in person, rather than someone who's not, is fully distanced, right, in terms of who will go in what order. We got the sense that February, in February, that we would begin being able to roll that out. The school districts will be actually doing providing information of the names of people. It will include substitutes. Our school nurses, just for you to know, anyone in the health profession, school nurses, LVNs, one-to-ones, are already going to be in 1A. So they will be in this first with the other medical field. So what our hope is that we're going to be, thank you. What our hope is we're going to be in a position, hopefully by mid-March, to have everybody have had their vaccinations, both the first and the second vaccination. But we had expected more supply to have come the beginning of this week, and it has not yet. And the only other thing that was described is that all the vaccinations do not go directly to public health. So some are going to Kaiser, some are going to CVS, some are going to, I forget what the other company is, like a CVS, right? That'll be doing, some of the testing or vaccinations. And the Kaiser decision about the tier, 1B, which is what we're going to fall into, is whether or not the other people in that tier include people 75 years or older. And so there'll be prioritization. But I think we can at least know that hope is on the way, particularly for people that are working in person. And we're hoping by February that will be rolled out. And we're going to continue to know more. Maybe Tara or Chris or Jim, can you guys help me? Anything I missed on that vaccination? I think that's kind of the story. And earlier, Superintendent Tara actually asked the question that, for one of these vaccinations, over 16, right? 16 and over are able to be vaccinated. So that's also going to be, like wondering where will that fall? So it'll be really, interesting. But we're at least we can see that there's a plan. We're working on it. And all of our schools are willing to do whatever we need to do. For some of you schools, you already provide, the Kaiser can come to your school and provide you a shot for the flu, right? So that's been already happening in some settings. So we're going to be ready to do whatever we can to facilitate if that's needed. So the roundabout answer is we don't know, but coming soon, and you should be hopeful.
All right, does anyone have any last questions before we sum everything up? No? Okay, just a final reminder about our student speaker series. There's a lot of really great opportunities within these series, and I think it'd be great for as many people as possible to be joining these Zooms. So Talia just resent the link into the chat. So if you guys want to check that out, that'd be great. Here again is the brochure for the different speakers It's a really, really great series, and the more people that are accessing this, the better. So the more we can send it around, also the better. Yeah, Talia, do you have any last things to say?
Just thank you to our superintendents and Mary Jane Burke and Michelle Drake, especially, who has been meeting with us so often and really working so hard on this. We're really excited for this speaker series and also for these meetings. I think it's so great to give our students a little information. I know that like the top 5 reasons why students are nervous is sometimes just because we don't have the information, and these are so calming and really reassuring meetings. So thank you all for being here and supporting us as students.
Yes. Thanks, Talia. Okay, we can't wait till the next one. Bye, everybody.
Bye. Thank you, guys.
Bye.